Good evening and welcome. I'm Dr. Linda Parker, and today I need to share something that could save your life or the life of someone you love. For decades, we've been taught to recognize the obvious signs of stroke: the facial drooping, the slurred speech, the sudden weakness. But what the medical community rarely discusses is that seniors often experience stroke symptoms that look nothing like what we've been trained to spot. These silent warning signs are frequently dismissed as normal aging, fatigue, or minor health issues, leading to devastating delays in treatment that can mean the difference between full recovery and permanent disability. The truth is, your brain doesn't always send the dramatic distress signals we expect during a stroke. In fact, research from the American Stroke Association reveals that nearly 40% of stroke patients over 70 experience what we call atypical symptoms, warning signs that masquerade as everyday discomforts. These subtle indicators are particularly dangerous because they create a false sense of security, causing both patients and their families to wait and see rather than seek immediate medical attention. What makes this even more critical is that every minute during a stroke, your brain loses approximately 1.9 million neurons. When we miss these early warning signs, we're not just losing time, we're losing brain cells that control everything from your ability to speak and walk to your capacity for independent living. The window for effective stroke treatment is narrow, typically just 4.5 hours from symptom onset, which makes recognizing these hidden warning signs absolutely crucial for anyone over 60. Today, I want to walk you through the 5 most commonly missed stroke warning signs that specifically affect seniors, explain why they're so often overlooked, and give you the knowledge to potentially save a life. These aren't the textbook symptoms you've heard about before. These are the subtle, deceptive indicators that even healthcare professionals sometimes miss. But once you know what to look for, you'll be equipped with life-saving knowledge that most people simply don't possess. The first warning sign that seniors consistently miss is sudden, severe dizziness that feels different from anything they've experienced before. Now, I want to be very clear about this because dizziness becomes more common as we age, and most episodes are completely harmless. However, stroke-related dizziness has distinct characteristics that set it apart from typical balance issues or inner ear problems. When a stroke affects the cerebellum or brainstem areas of your brain, it disrupts the neural pathways that control balance and spatial orientation. This isn't the gradual onset dizziness you might feel when standing up too quickly, or the spinning sensation of vertigo. Stroke dizziness typically comes on suddenly and intensely, often described by patients as feeling like the world has shifted or tilted without warning. What makes this particularly insidious is that it frequently occurs without any of the classic stroke symptoms we've been taught to recognize. The key distinguishing factor is the intensity and sudden onset. One moment you're feeling completely normal, and the next moment you're gripping the nearest surface because your brain can no longer properly process information about your position in space. This dizziness often comes with a feeling of being disconnected from your surroundings, almost as if you're watching the world through a fog. Unlike typical age-related balance issues, this dizziness doesn't improve when you sit down or close your eyes. What's particularly dangerous about this symptom is that many seniors attribute it to medication side effects, inner ear problems, or simply getting older. They'll often say something like, "I've been having more dizzy spells lately," treating it as a minor inconvenience rather than a medical emergency. Family members, too, might dismiss it, especially if their loved one has a history of balance problems or takes medications that can cause dizziness. The neurological mechanism behind this symptom involves the posterior circulation of the brain, which supplies blood to the cerebellum and brainstem. When blood flow to these areas is compromised, even temporarily, it can create this overwhelming sense of spatial disorientation. The reason this is so dangerous is that strokes affecting the posterior circulation are often missed in emergency rooms because they don't present with the classic symptoms that healthcare providers are trained to look for immediately. If you or someone you know experiences sudden, severe dizziness that feels completely different from any previous episodes, especially if it's accompanied by any other unusual symptoms, it's crucial to seek medical attention immediately. Don't wait to see if it passes. Don't lie down hoping it will improve. And don't assume it's related to a new medication or inner ear issue. Time is brain tissue, and this symptom could be your only warning that a stroke is occurring. The second warning sign that's frequently overlooked is an unusual, severe headache that feels unlike any headache the person has experienced before. This isn't your typical tension headache or even a migraine. Stroke-related headaches have a quality that many patients describe as explosive or thunderclap-like, often reaching peak intensity within seconds to minutes. What makes this symptom particularly confusing for seniors is that headache patterns often change with age anyway. Many older adults experience new types of headaches due to medication changes, blood pressure fluctuations, or other age-related factors. However, a stroke-related headache has several distinguishing characteristics that set it apart from these more common headache types. The headache associated with stroke, particularly hemorrhagic stroke, typically comes on with a suddenness that's alarming. Patients often describe it as the worst headache of their life, even if they've suffered from chronic headaches for years. The pain is usually severe and may be accompanied by neck stiffness, sensitivity to light, or nausea that seems disproportionate to typical headache symptoms. What's neurologically happening during this type of headache is that blood vessels in the brain are either rupturing or becoming severely compromised, causing increased pressure within the skull. This increased intracranial pressure triggers pain receptors in ways that create the characteristic explosive quality of stroke-related headaches. The pain often differs from migraine pain, in that it doesn't build gradually, but rather hits with full intensity almost immediately. The dangerous aspect of this symptom is that many seniors have learned to manage chronic headaches and may initially try their usual remedies, taking over-the-counter pain medications, lying down in a dark room, or using heating pads. They might tell family members, "I have a terrible headache, but I'll be fine," not realizing that this particular headache signals a medical emergency requiring immediate intervention. Another confusing factor is that stroke-related headaches don't always follow the patterns we might expect. They can occur on either side of the head or affect the entire head, and the intensity may fluctuate rather than remaining constant. Some patients report that the headache feels like pressure building inside their skull, while others describe it as a sharp stabbing sensation that's completely different from any previous headache experience. Family members should be particularly alert when a senior describes a headache as being unlike anything they've experienced before, especially if the person typically doesn't suffer from severe headaches. The key phrase to listen for is when someone says this headache feels different or worse than any previous headache. This isn't about severity compared to their normal headaches. It's about the quality and character of the pain being completely unfamiliar. If someone experiences this type of sudden, severe headache that feels unprecedented in their experience, medical attention should be sought immediately, even if other stroke symptoms aren't apparent. The headache itself can be the primary warning sign of a stroke in progress, and waiting to see if it resolves could result in irreversible brain damage. The third warning sign that seniors frequently miss is sudden confusion or difficulty understanding what's happening around them. This symptom is particularly insidious because it can be easily mistaken for normal age-related cognitive changes, medication side effects, or even early signs of dementia. However, stroke-related confusion has specific characteristics that distinguish it from these other causes. When a stroke affects areas of the brain responsible for processing information and maintaining awareness, it can create a sudden fog of confusion that descends without warning. This isn't the gradual confusion that might develop with dementia or the grogginess that comes with medication side effects. Instead, it's an abrupt change in mental clarity that can make familiar surroundings suddenly feel foreign, and routine tasks seem impossibly complex. The neurological basis for this symptom involves disruption of blood flow to areas of the brain that process sensory information and maintain cognitive function. When these areas don't receive adequate blood supply, even for a short period, they can't function properly, leading to confusion, disorientation, and difficulty processing information that would normally be routine. What makes this symptom particularly dangerous is that both the affected person and their family members might rationalize it away. They might think, "Dad's just having a bad day," or "Mom seems more confused lately, but she's been forgetting things anyway." This tendency to normalize the confusion can delay critical medical intervention during the narrow window when stroke treatments are most effective. The confusion associated with stroke often has a sudden onset that's quite different from gradual cognitive decline. One moment the person is functioning normally, and the next, they might not understand where they are, what time it is, or why family members are present. They might ask the same questions repeatedly, not because they're not listening to the answers, but because their brain isn't properly processing and retaining the information. Another characteristic of stroke-related confusion is that it often affects the person's ability to understand complex information while leaving some basic functions intact. They might remember their name and recognize family members, but be completely unable to follow a simple conversation or understand why everyone seems concerned about them. This selective impairment can make the situation even more confusing for family members who might think, "Well, she knows who I am, so she must be okay." The person experiencing this confusion might also have difficulty expressing what they're feeling. They know something isn't right, but they can't articulate what's wrong or why they feel so disoriented. This internal awareness combined with inability to communicate effectively can create significant anxiety, which family members might misinterpret as agitation or personality change rather than recognizing it as a stroke symptom. What's particularly important to understand is that this confusion can come and go in waves, which makes it even more likely to be dismissed. The person might have periods of relative clarity followed by episodes of significant confusion, leading family members to think the problem isn't serious because it seems to be improving on its own. If a senior suddenly becomes confused about their surroundings, can't follow simple conversations they would normally understand, or seems disoriented in ways that are completely out of character for them, this should be treated as a potential stroke symptom requiring immediate medical evaluation. Don't wait to see if the confusion clears up on its own, and don't assume it's related to medication, fatigue, or normal aging processes. The fourth warning sign that's consistently missed is sudden, unexplained nausea and vomiting that seems to come out of nowhere. While nausea and vomiting are common symptoms that can result from countless minor illnesses, stroke-related nausea has specific characteristics that make it different from typical stomach upset or food-related illness. When a stroke affects the brainstem, particularly areas that control balance and coordination, it can trigger the body's nausea and vomiting reflexes even when there's nothing wrong with the digestive system. This happens because the same neural pathways that help maintain balance and spatial orientation are closely connected to the systems that control nausea and vomiting. When these pathways are disrupted by reduced blood flow, the result can be sudden, severe nausea that seems completely unrelated to anything the person has eaten or any other obvious cause. The distinguishing feature of stroke-related nausea is its sudden onset combined with the absence of other typical illness symptoms. Unlike food poisoning or stomach flu, there's usually no preceding stomach discomfort, no fever, and no gradual buildup of queasiness. Instead, the person feels fine one moment and then suddenly becomes overwhelmingly nauseated, often to the point of vomiting. What makes this symptom particularly deceptive is that many seniors immediately assume they've eaten something that disagreed with them or caught a stomach bug. They might say, "I must have eaten something bad," or family members might think, "It's probably just a stomach virus going around." This natural tendency to find a simple explanation for the symptoms can delay recognition that something more serious is occurring. The neurological mechanism involves the vestibular system and the area postrema in the brainstem, which serves as the body's vomiting center. When blood flow to these areas is compromised during a stroke, they can trigger intense nausea and vomiting as they struggle to function properly. This is why stroke-related nausea often comes with a sense of spinning or movement even when the person is lying still, and why typical nausea remedies often don't provide relief. Another characteristic that distinguishes stroke-related nausea is that it typically doesn't follow the pattern of gastrointestinal illnesses. With stomach flu or food poisoning, nausea usually comes in waves and may improve after vomiting or when the stomach is empty. Stroke-related nausea tends to be more persistent and doesn't necessarily improve with typical remedies like rest, clear fluids, or anti-nausea medications. The timing of this symptom can also be telling. If someone experiences sudden, severe nausea without any apparent trigger, they haven't eaten anything unusual, haven't been around sick people, and haven't engaged in any activities that would typically cause stomach upset, this unexplained onset should raise suspicion that something neurological might be occurring. Family members should be particularly concerned if the nausea is accompanied by any other unusual symptoms, even seemingly unrelated ones like dizziness, confusion, or headache. The combination of sudden nausea with other neurological symptoms significantly increases the likelihood that a stroke may be occurring. It's also important to note that stroke-related nausea doesn't necessarily respect typical patterns. It can occur at any time of day, regardless of when the person last ate or what activities they've been engaged in. The key is the sudden, unexplained nature of the symptom combined with its severity and persistence. If someone experiences sudden, severe nausea that seems to have no obvious cause, especially if they're in a higher-risk age group or have other stroke risk factors, it's crucial to consider the possibility of stroke and seek medical evaluation promptly. Don't assume it's a minor stomach issue that will resolve on its own, particularly if the person seems unusually unwell or if other symptoms develop. The fifth, and perhaps most dangerous warning sign that seniors miss is sudden difficulty with vision that doesn't necessarily involve complete vision loss. This can manifest as double vision, sudden blurriness that doesn't improve with blinking or adjusting glasses, loss of peripheral vision, or visual disturbances that seem to come and go. These vision changes are frequently attributed to normal aging, eye strain, or problems with eyeglasses, when they could actually signal a stroke affecting the visual processing areas of the brain. When a stroke occurs in areas of the brain responsible for processing visual information, it can create a wide range of visual disturbances that are often subtle enough to be overlooked initially. Unlike complete blindness, which would obviously prompt immediate medical attention, these partial visual changes can seem minor or temporary, leading both patients and family members to adopt a wait-and-see approach. The visual cortex and the neural pathways that process sight are located in the posterior part of the brain, and strokes affecting these areas can cause visual symptoms that seem unrelated to brain function. The person might experience double vision that makes reading impossible, sudden blurriness that makes faces hard to recognize, or loss of side vision that causes them to bump into objects or miss things in their peripheral view. What makes these visual symptoms particularly dangerous is that they're often intermittent in the early stages of a stroke. The person might notice that their vision seems off, but then it appears to improve, leading them to think it was just eye strain or fatigue. This fluctuation occurs because the brain tissue in the affected area is still receiving some blood flow, but not enough to function optimally, creating periods of better and worse visual function. One of the most commonly missed visual symptoms is what's called hemianopia, which is the loss of half of the visual field in both eyes. This doesn't mean the person goes blind in one eye, but rather that they lose the ability to see either the right or left side of their entire visual field. Someone experiencing this might notice they're bumping into door frames on one side, missing food on one side of their plate, or having difficulty reading because they can't see the beginning or end of lines of text. Another frequently overlooked symptom is sudden onset double vision that makes it impossible to focus on objects clearly. This happens when stroke affects the areas of the brain that coordinate eye movements, causing the eyes to not work together properly. The person might try to compensate by closing one eye or tilting their head, and family members might initially think they're just having trouble with their glasses. Visual disturbances can also include sudden difficulty judging distances or depths, which can make activities like walking downstairs or reaching for objects dangerous. The person might reach for a cup and completely miss it, or misjudge the height of a step and stumble. These spatial visual problems are often attributed to general clumsiness or aging rather than recognized as potential stroke symptoms. The reason these visual symptoms are so often missed is that people naturally try to compensate for visual problems, and partial vision loss or disturbances can be worked around initially. Someone might unconsciously turn their head more to see things in their peripheral vision. Or they might attribute reading difficulties to needing stronger glasses rather than recognizing that their brain isn't processing visual information correctly. Perhaps most importantly, these visual changes often occur without other obvious stroke symptoms, making them seem like isolated eye problems rather than neurological emergencies. The person might feel fine otherwise and assume they just need to see an eye doctor, not realizing that their visual symptoms could indicate a stroke requiring immediate medical intervention. If someone suddenly develops any unusual visual symptoms, double vision, unexplained blurriness, loss of peripheral vision, difficulty judging distances, or any other visual changes that seem to come on without explanation, these should be treated as potential stroke symptoms, especially in someone over 60 or with stroke risk factors. Don't wait to see if the vision improves on its own, and don't assume it's simply an eye problem that can wait for a routine appointment with an eye care professional. The critical message I want you to take away from today's discussion is that stroke symptoms in seniors often look nothing like the dramatic presentations we see in medical dramas or public health campaigns. These 5 warning signs, sudden severe dizziness, unlike previous episodes, unprecedented headache pain, unexplained confusion or disorientation, sudden nausea without obvious cause, and visual disturbances that seem minor initially, are frequently dismissed as normal aging or minor health issues when they could actually represent medical emergencies. The reason these symptoms are so dangerous is that they create a false sense of security, leading both patients and families to delay seeking medical attention during the critical window when stroke treatments are most effective. Every minute that passes during a stroke results in the death of nearly 2 million brain cells. And the difference between seeking help immediately versus waiting to see if symptoms improve can literally mean the difference between full recovery and permanent disability. What's particularly important to understand is that these symptoms can occur alone or in combination, and they don't always follow the patterns we might expect. Someone might experience just one of these symptoms initially, with others developing later, or they might have several symptoms that seem unrelated to each other. The key is recognizing that sudden changes in how someone feels or functions, especially changes that seem out of character or unexplained, should always be taken seriously in seniors. I want to emphasize that being aware of these symptoms isn't about becoming paranoid or rushing to the emergency room for every minor discomfort. It's about developing a more nuanced understanding of how stroke can present in older adults and being prepared to act quickly when something seems genuinely different or concerning. Trust your instincts. If something feels wrong or unusual, especially if it involves sudden changes in neurological function, it's always better to seek medical evaluation and be reassured that everything is fine than to wait and potentially miss a critical opportunity for treatment. The most important action you can take right now is to share this knowledge with the seniors in your life and make sure they understand that these symptoms require immediate medical attention. Create a plan with your family members about what to do if anyone experiences these warning signs, and don't hesitate to call emergency services or go to the nearest emergency room if you suspect someone might be having a stroke. Remember, recognizing these hidden warning signs could save your life or the life of someone you love. The brain you save by acting quickly on these subtle symptoms could mean the difference between someone maintaining their independence and quality of life versus facing permanent disability. Stay informed, stay vigilant, and never underestimate the importance of trusting your instincts when something doesn't seem right, because sometimes the most important medical emergencies announce themselves in whispers rather than shouts.